Welcome to EconTalk, part of the Library of Economics and Liberty. I'm your host, Russ Roberts of Stanford University's Hoover Institution. Our website is econtalk.org, where you can subscribe, comment on this podcast, and find links and other information related to today's conversation. You'll also find our archives where you can listen to every episode we've ever done going back to 2006. Our email address is mail@econtalk.org. We'd love to hear from you. Today's December 8th, 2016, and before introducing today's guest, I want to encourage listeners to go to econtalk.org. You'll find a link there to vote for your favorite episodes of last year of 2016 and give us some additional feedback about your listening habits. Really appreciate that. Now on to today's guest, author and economist Mark Warshawsky, Senior Research Fellow at the Mercatus Center at George Mason University. Mark has written widely on pensions, retirement, Social Security, and other policy issues, and our topic for today is a recent working paper he's written, Earnings Inequality, the Implications of the Rapidly Rising Cost of Employer-Provided Health Insurance. Mark, welcome to EconTalk.
Thank you. I really appreciate the opportunity to chat about this.
Well, it's incredibly important, and this is an area of general interest to me, and in particular, the focus on inequality, but also standard of living, which whenever we try to measure compensation, income, these kind of issues that you raised in your paper come up. And I thought you had some insights and some facts that were rather startling and illuminating. So I'm very excited to talk about it. I want to start with some basic economic logic. What's the difference between, say, compensation and take-home pay for a worker?
Well, there are many differences between the two. For most workers, they get a whole package of both pay and benefits when they work for an employer. They may get a pension, or they may get a contribution to a 401k plan. And what's particularly relevant here is they very frequently will get health insurance whose costs will be shared between the employer and the employee. But it's very important to remember that for most workers, most of the cost is paid for by the employer. And as we'll discuss, health insurance is very expensive. So this is a major cost for an employer and a major part of the compensation package. There may be other benefits that an employer will give to workers. Certainly, vacation time and other types of leave, perhaps other types of benefits, and then of course added to the pay that the worker actually takes home. So there are a lot of components to compensation, and part of the issue that is included here in this research and also in the politics of this matter is take-home pay is pretty noticeable, and it's pretty easy to measure. And it's in official records and tax records and earnings and so on. But the other parts of compensation, the benefits that workers get, are harder to measure and aren't as frequently measured, and so they're sometimes not noticed as much in terms of their cost. It's not noticed as much to the worker, and it's not noticed as much to the researchers who look at these matters. But I can assure you, the employer knows very much what all this costs, and it's very much part of the employer's consideration in terms of how to design the compensation package, and what they can afford to pay, given their profits and their business, what they can afford to pay in terms of straight take-home earnings. The employer really pays attention to these costs very carefully.
So there's a gap to start with between what the employer pays and what the employee receives. Physically, literally, there's a gap, meaning the employer has to pay for it. The employee takes home the cash part of it, and it's possible that the benefits that the employer has to pay for are worth the same amount to the employee. So the compensation that the employer receives is equal to the compensation that the employer pays. But it's also possible that the value of the benefits provided by the employer, which the employer has to pay for, may not be valued for all employees equally, and by some, not at all. So if the employer provides, say, daycare on site for employees, and I don't have any children, then that's a form of compensation. That's a cost to the employer that I get no benefit from, whereas somebody who has multiple children might find that to be a wonderful value. And the point I want to emphasize – so first, talk about that and how the labor market works in dealing with these issues about compensation versus income for employees.
Yeah, so there's a very complex mix of considerations to an employer in designing a benefits package. Sometimes it has to be done in a one size fits all manner, and so if they feel that some employees would appreciate, let's say, as you indicate, child care. It obviously costs the employer quite a bit, but they give it to everybody, and they don't necessarily make an adjustment on a one worker by worker basis, to the rest of their pay as to whether they're using the child care or not. So sometimes these things are done, through approximations and averages. But there's another consideration, and this is very important to our topic, is that there are also a lot of government rules that pertain to these benefits. And in particular, there's something called non-discrimination requirements in the tax code that particularly apply to retirement benefits and to health benefits. And they state, they're very complex, and so I'm not going to go through all the nooks and crannies of them, but in very broad terms, they say that regardless of whether the worker is high paid or low paid, everyone gets the same benefits. In retirement benefits, that's usually as a percent of pay. But for health benefits, it means the same benefits in dollar terms, so that the lower paid worker gets the same health insurance benefits in terms of the cost to the employer as the high paid worker. And that is a government requirement. Now, there are many other government requirements, coming from different parts of federal and state law, and they have a big influence on how these packages are designed. And, we could discuss, whether they're good policy or bad policy, but at least for our purposes, we have to recognize that they exist and they have an important influence on the design of how benefits are provided.
So let's talk about the role of taxes. Almost all, maybe, you tell me, most benefits are not taxable in the same way that income is taxable. So you could think about if you gave me, let's say that you as the employer cover, say, $5,000 worth of health care insurance for me. One alternative would be you could raise my salary by $5,000 and let me pick my own health care plans, not approved by the company, et cetera. And that's not as attractive to me in many cases, because if you give me $5,000 in income, I have to pay taxes on it. If you provide $5,000 of health care coverage or all kinds of other things that might be provided on the job, I tend generally not to pay taxes on that. And that leads to, which seems like a good thing, but that has problems. So talk about that just as a general aspect of benefits.
Yeah, you're 100% correct. Most, not necessarily all, but most benefits that are provided by employers are not taxed to the employee as income. The motivation for that, and this goes back way back to the beginning of the income tax. The motivation was that they're meant as a type of incentive or a type of encouragement to the employer and to the employee to demand these benefits. I think the notion is, it's because it was thought that to have retirement benefits and to have health benefits is a good thing, and that employers and workers should be encouraged to have it, and so therefore they're not taxed. Again, in retirement benefits, the rules are very complex. It's not a totally open tax treatment, so there are limits Some people may recall that, for example, in their contributions to their 401k account, there are dollar limits that apply to restrict the amount of money that can be contributed tax-free to 401k accounts. Again, the important point here when our discussion of health insurance, there are no such limits for health insurance. So even very, very generous plans, no deductibles, no co-pays, no employee contribution for the insurance premium, and there are such plans out there, totally tax-free. So that obviously is a contributing factor to, having these plans, and sometimes, and I think many people argue for them to just grow seemingly without limit.
So the last point, or at least I think is the last point before we turn to healthcare in particular, that I think is so important and so unintuitive for most people is the idea that mandating benefits for workers is not a free lunch. I think a lot of people, certainly on Twitter and pundits in the op-ed pages of our newspapers and publications, have a tendency to say, well, if the government forces employers to provide benefit X, then that's good for workers because then that makes sure they have that benefit. And what people neglect is that almost inevitably, I suppose we could cook up some scenarios where this is not true, but it's not easy to do, but that almost inevitably means lower take-home pay, lower salaries in terms of cash for that worker. And it's imaginable, and often the case in my belief, that workers would prefer the cash to the benefit. It's true that the benefit is tax-free, but sometimes the benefit isn't of value. So, one example I always think of, and this is subtler relative to the standard benefit discussion we've been having, one example would be safety regulation. So everybody likes the idea of a safe workplace. The question is, if you mandate certain expenditures by employers to make the workplace safe, that is maybe a way to help workers that is not as productive as paying them more money and letting them take their own steps to stay safe on the job. That is, it may be cheaper for workers to reduce the risk of injury than for employers. That's not always the case, of course. And employers have a natural incentive to make their workplace safe because they want to attract workers to a safe workplace. It's easier than to attract them to an unsafe one. But if you wanted a, quote, unsafe one, and it's not black and white, it's not 0-1, it's actually continuous. If you wanted a relatively less safe workplace, you might be able to attract workers there with higher pay who would then take their own steps to make sure that they're not hurt on the job, and that might be better for the workers, especially who are poor, who have low skills. And so when we mandate benefits for low-skilled workers in the name of helping them, we've taken away some freedom from them and some well-being because they cannot use their money as they might choose. And you can get into a debate about whether they can choose wisely, and I, of course, as listeners know, tend to be sympathetic to the idea that they can choose more wisely than the employer or the government. But that's the debate. The important thing is to recognize, I think, the unavoidable truth that benefits aren't free. They come out of the salaries of workers, and that is a cost that has to be taken into account.
Yeah, I mean, as you indicated, it really is economics 101. I mean, there may be a very few circumstances where the employer, if they're mandated to provide benefits, can pass that cost along. If they're a regulated monopoly or sell their products in monopoly situations and they don't have much competition. But let's face it, when you're doing business in a global economy, there aren't many of those type of organizations around. So most employers, vast majority of employers, pay their workers, and it's compensation. It's not the take-home pay. They look at the cost of the employee as the cost of pay, as benefits, as well as the mandated benefits that they have to provide. And if there's more mandated benefits, and the going rate for workers is X, and in the profits that they make and what economists call the marginal product is Y, and if part of X goes up because of this mandated benefits, well, that means that the take-home pay is going to have to go down, and it's you can almost call it a law of economics. In other words, it's something that you can't get around. Again, except in very special circumstances.
And it's not. I want to make the point. It's not just mandated benefits. It could be that there are many benefits on the job that we don't think about. We tend, when we say on the job benefits or compensation, or we tend to think of these dramatic large categories like healthcare, vacations, a company car, cell phone, dental care, health care, retirement, et cetera. But of course, employers provide all kinds of things on the job that are not obvious and we don't think about, like a warm place. There's heat, there's light, sometimes there's a uniform, sometimes there's training and explanations of things, and there's camaraderie and a corporate culture, and all these things are part of the job. And if culture, or more importantly, competition, encourages employers to provide something for employees, and that thing gets more expensive, even if it's not mandated, but it's just part of the competitive environment, employers are going to respond to that. And how we then observe, since we don't easily observe compensation, but rather easily observe take-home pay, we may underestimate the well-being of workers or their relative situation to, say, 10, 20 years ago, simply because we're not really measuring the right thing. And although we're going to focus on inequality, I also want to think about how these kind of issues affect our perception of changes in standard of living over time, not just the inequality issue. And it's, of course, both. They interact. So do you want to say anything about that before we go on?
No, I'm very sympathetic to what you're saying, and it there certainly have been some attempts over the years to try to measure these things, but they're hard, and that's why getting a little bit into my contribution here, when you get some unique data sources, that in fact does measure the cost of some of these benefits. That gives us a great insight that we didn't have before.
So let's start with just the logic of your argument, not the particular measurement, the ways you're going to measure it, but your claim, which is quite clever and appears to be a matter mainly of just logic rather than bias or ideology. Your claim is that rising healthcare costs affect our measurement of inequality if we're only looking at earnings rather than compensation. So it's a little bit complicated, but it's just pretty much basic algebra and logic. We're not going to do the algebra on the air, but we'll do the intuition of the logic. What's the argument you're making?
Yeah, it is. I think just basically arithmetic, but maybe to sort of put this in context a little bit, even before I go into the logic. The important thing to keep in mind is how much. I don't think people realize how much these costs have gone up. So here I'm going to cite a statistic from the Kaiser Foundation, which collects information on the cost of health insurance. Just from 1999 to 2014, so 15 years, the cost to an employer, and this is on average, of health insurance. So this is what the employer is paying, not what the employee is paying. What the employer is paying for health insurance tripled. That's just in 15 years. And so the income didn't triple, the economy didn't triple, but the cost of health insurance tripled in just 15 years. And so when you have that sort of, I would say, I don't know if you call it dislocation or disequilibrium, or just sort of a massive change in an important part of the pay package, of course it's going to have impacts on things which are more easily measured, which are earnings. So, anyways, getting to the logical argument here. And we'll simplify it a little bit. It's of course more complicated when you look at the data and when you consider a lot of institutional and market considerations. But let's think of it in pretty simple terms. The cost of insurance the health insurance to an employer is the same whether the worker is high paid or low paid. And that's true, as I indicated, by law because of non-discrimination requirements, but it's also simply because that's simply the way, pay packages work. That's sort of, or even call it custom or just for peace within the labor force, that everyone gets the same health insurance benefit, regardless of whether they're high paid or low paid. Now, obviously, there are high paid and low paid workers. People with more education or more value to the employer are going to be paid more, as opposed to people who are either younger or don't have as much experience or simply don't provide as much value and profit to the employer are obviously going to be paid less. So, that's just natural and what everyone would expect. The employer looks at the whole cost. He doesn't look just at the take-home pay. He looks at, what does the insurance cost me and what does the take-home pay cost me, and they combine that, and then they, say, is the total package, going to make sense for this worker and for that worker? Now, when health insurance is going up so much over a short period of time, that's going to change relationships that heretofore were occurring in terms of take-home pay. So that, let's say at the initial point of our analysis, let's say health insurance cost $4,000 per worker. For the worker who was earning $40,000, that represented 10% of pay. But for the worker who was earning $100,000, it was only 4% of pay. So let's say that cost doubles. So it's $8,000. So for the worker earning $40,000, that's obviously going to be a lot higher percentage than for the worker that's earning $100,000. And even if everyone gets a compensation pay increase because, let's say, the company is doing better or the economy is doing better over time, productivity increases and so on, the employer still has to pay the money for the health insurance, and that represents more of percent of compensation for the low-paid worker than for the high-paid worker. And so the employer will increase take-home pay for everybody, but they're going to have to increase it less for the low-paid worker than for the high-paid worker, because the cost of having the worker has gone up, because of the cost of health insurance, and that represents more of the total compensation for the low-paid worker than for the high-paid worker. And you're going to see, at the end of the day, that the take-home pay for the high-paid workers will have increased more than for the low-paid workers.
So I want to take a step back and take a slightly different way of thinking about the numbers here and see if I'm doing it right.
Okay.
Part of the challenge of all this is that there's 3 million things happening at the same time. The economy's growing. There's increases and decreases in the demand and profitability of a product of a particular company. There's increased scarcity of certain types of labor. So to make it simple, let's say all that's flat and static. It's the kind of thing that drives non-economists crazy, but it helps you see what's actually going on. That's the reason we do this as a mental exercise. So let's say nothing is changing in the economy except healthcare is getting more expensive. And let's say that healthcare insurance doubles in the example you gave. So I'm the low-paid worker. I was making $40,000 in take-home pay, and I had this nice compensation in the form of health care insurance that was worth $4,000. And you're the high-paid worker. You're making $100,000 in take-home pay, but your compensation is actually $104,000. So the ratio of our compensation is 104 to 44, but we don't see that. We just see the 100 to the 40.
Right.
Now let's say health insurance doubles. It goes to $8,000, the example used, and I'm not any more productive, and neither are you. What's going to happen in the marketplace approximately, and there's some wiggle room for this, but let's just take the extreme case. My take-home pay is going to go down. It's going to go down to 36 from 40 because my total compensation is going to stay at 44. I'm no more valuable to my employer than I was before. So their first impulse is going to, not their impulse, competition among employers is going to tend to drive the salary of people like me down to 36, and yours is going to go down to 96. And the ratio of 96 to 36 is not the same ratio as 100 to 40. And as a result, did I do that right?
You did it exactly right, and I'll just conclude your thought. Therefore, it will look like the lower-paid worker is falling behind the higher-paid worker proportionally, but that's not actually the case because, as we know, total compensation for both workers has not changed at all.
Right. So the absolute gap between us is the same, but the ratio, which is what we tend to look at in these stories, has changed. And now let's move forward. Let's have healthcare ratchet up steadily, right? Healthcare gets increasingly expensive. And if that's happening, the gap between you and me is just going to continually get bigger if nothing else changes. Now, of course, something else is going to change. Salaries are growing in general in an economy that's growing. But it's going to look like they're not growing very quickly because an increasingly large share of it is going toward healthcare. So there's two things going on that are deceptive when we only look at income rather than full compensation. The first is it'll look like as the poor were, on average, forget the poor and the rich, forget the inequality issue. The first thing you're going to notice is that the growth in income is going to be relatively low compared to the growth in compensation. That's the second thing is that the inequality at any point in time is going to be growing because compensation as a proportion of benefits as a form of total compensation is increasing more rapidly than take home pay is going to be. And that's always going to be true when say it's doubling or tripling healthcare insurance costs because productivity doesn't go up that fast. The other point to make is that and this is just a reality. This is not it's hard. Sometimes there's so much emotion around these issues. I think it's really hard to think about them clearly. But the reality is that in that not so attractive scenario where my take home pay falls by an additional $4,000 to 36, I don't necessarily get $8,000 worth of benefit just because health insurance is more costly. I do if I need it. I really want it, right? If I really feel compelled to have health insurance, the fact that it's $8,000 now and paid by the employer, that's worth it for me. It's true, my take-home pay is down to 36 from 40, but I value it. And the more complicated case will be in terms of measuring standard of living and inequality is when I don't value it. If it's gone up in ways that are not productive for me, but I'm through either mandates or competition, I'm forced to pay that for it. I mean, I think it's just, if nothing else, listeners should realize that I'm paying for those increases in healthcare insurance, not the employer. Just because it's, quote, covered by the employer masks what's really going on underneath.
Yeah, I mean, that bleeds into a related topic, which I think is very relevant for politics and also the policy and the economics of the issue is healthcare costs are exploding. They are rising very rapidly. And the question comes both at the individual level and at the company level and at the level of government and society as to whether those benefits are worth it. In other words, whether they're on the margin providing us with a lot of increased health and and increased longevity and so on. There's a strong debate about this, and there's some reason to think that, they're not providing that marginal benefit. Again, particularly when you consider the very rapid increase in cost. So I think that becomes relevant when we think about this at a higher level. But you're certainly right. Even at the individual level, people have different preferences for these type of benefits, and compared to young, compared to old, all sorts of individual situations, and just general attitudes towards risk and attitudes towards even getting health care. Some people are more interventionist in their situation, and others are more don't necessarily go to the doctor at every sniffle. So even at the individual level, not even considering broad societal considerations, people have different preferences for these things, and one size fits all is probably not the best solution.
So just to clarify the two issues that I think are easily confused, that I probably jumbled up in the last comment I made, and while saying that we shouldn't confuse them, let me make it clear. Philosophically, people may differ and do differ on whether government should mandate certain kinds of benefits. They can. I happen to be a person who's very opposed to that, but I understand the argument. It's not open and shut. You can be a fine human being and think the government should mandate health care, the government should make health care insurance deductible, et cetera, for all kinds of reasons, political economy, philosophical, ideological reasons. At the same time, there's a separate issue that we're talking about here, which is once you do that, the measurement of well-being of workers and the inequality across workers is going to be much more difficult to observe because we don't regularly generate government reports on compensation in dollar terms. We instead generate reports on worker pay in dollar terms. We are missing a large part of compensation, and that affects our understanding of inequality, and it affects our understanding of well-being over time, changes in standard of living, progress for low and middle income and high income workers, and that has nothing to do with whether you think it's a good idea to have mandated health care or government benefits of this kind or another, or the non-discriminatory kinds of regulations that we face. We're simply talking here about the numerical part. And to me, the only thing controversial about that part of this is, quote, who pays for it. That is, the story I just told where salaries fell from 40 to 36, it is possible under different models of the labor market that the employer might have to eat some of those costs. They won't all be imposed on the employee. So when you said earlier that between 1999 and 2014, healthcare costs to employers tripled, my first thought is, well, that means that employees had to pay triple because it comes out of their compensation. Now, you can debate that. That is debatable. You can argue that it doesn't all come out of compensation. And economists, this has to do, we're not going to get into it, with the elasticity of supply and demand for labor of certain types, but that there is an effect on employees when costs go up to employers you can't argue with that. You can argue about the size of it. You can argue how important it is. You can argue about whether employers have to bear some of those costs. They don't all fall on the employees, that markets aren't fully competitive, et cetera, et cetera.
At one time, when these measurement systems and tax systems were designed, back in the 40s and 50s, when these benefits were not very costly, health insurance was cheap, so maybe it didn't matter as much because it was more than almost a rounding error, or it wasn't that significant in terms of whether perhaps we didn't tax it or we didn't measure it in our income measurement systems. It didn't matter as much. But when you have these costs increasing as rapidly as they have, those systems of measurement, become increasingly outmoded as ways of looking at people's well-being and, just in terms of what they're earning, what they really are earning. So, that is also a reality that, when these costs have increased so much, we just have fallen behind in our ability to both understand and measure these things.
Okay, so now let's come to the magnitudes. So, as you say, in the old days, it was a small proportion. So this distinction between compensation and income was relatively unimportant. And then now the question is, well, how important is it? And I think when I argue with people about the importance of focusing on compensation rather than just income, one of the things you hear is, well, okay, it's true, but low-income workers, middle-income workers, they don't really get many benefits. The most of the benefits are accruing to, it used to be the case that everybody would say get a pension, but now that's mostly gone, and only the higher-end workers are getting benefits. So let's first just talk about the rough, crude magnitudes for who are the magnitude of benefits for workers across different income levels in the economy today. What do we know about that?
I'm just going to. I'll cite some statistics from my paper. So just taking 2 years, 1992 and 2010. So looking at the lower paid workers, those who were in the 30th percentile. So these are people basically earning, they're full-time workers, but they're basically earning minimum wage. Their health insurance as a share of compensation, and this is data from the Bureau of Labor Statistics. So this is based on a government survey. It's a very well-established survey, very carefully designed, and it's a survey of employers. So it doesn't require the recall of workers, as to what they think they're getting and what maybe they're getting. It's directly to the employer that knows what these things cost. So anyway, so in 1992, at the low income worker, their health insurance as a share of compensation was about 7.5% of compensation. For the very highest paid worker in the 99th percentile, so we're talking about the 1% that people talk about, their health insurance as a share of compensation was only 4.5%. So, because again, it's sort of to a first degree approximation, it costs the employer the same thing to provide health insurance, whether it's a very high paid worker or a low paid worker. Now, in reality, there are distinctions, and there are differences by geography, by type of employer, and so on. But again, these are actual statistics from this survey of employers, and the low paid workers had a higher share of health insurance paid by their employer as a part of compensation compared to the high-paid worker.
And repeat the ratio again. This is 1992. It was 7 point something to 4 point something, right?
Yeah. So basically 7.5% to 4.5%.
Okay.
So
fast forward.
Health insurance benefits were more costly as a share of compensation, total compensation, for the low-paid worker than for the high-paid worker. And these are, incontrovertible statistics, again, based on the survey. So it's not a matter of ideology or some claim that, low-paid workers don't get health insurance.
Or your attempt to try to measure what the health care is worth to a low-wage paid worker or a high-paid worker. These are just what the government gathered from employers that they paid out of pocket.
Yeah. What it cost them to have those workers working for them. Exactly.
So it's just important. Okay. It's just important to add that we've said many times that it's hard to measure these benefits. That's only because of the way the government tends to report them, right? So we have surveys of workers where we ask people what they earn. We have surveys of employers. We ask them what they pay. The things that typically get reported and talked about in the media are income. These compensation numbers that you're quoting, they're black and white. They're checks written by employers that it's not like, well, I wonder what it is, how important it is, I'm going to guess. These are costs to employers that are measured in this survey, right? So it's
It is indeed, based on a survey of employers. Most of the time that people talk about pay, they talk about their income, and a lot of times that comes from income tax returns. And a lot of scholars that look at income inequality basically focus on income tax data. But again, that's take-home pay. It does not include these non-taxed sources of compensation. They're simply not on the tax return.
Carry on.
So, yeah.
So 92, 7.5 to 4, something. Go forward to 2000. You were saying, I interrupted you. In 1992, the ratio from the 30th percentile worker to the first percentile worker was 7.5 to 4 point something. Go forward, and what is it? 4.5,
exactly. So now we move to 2010. Pay has gone up, but benefits have, the cost of health insurance has gone up even more. So in 2010, looking at the low-paid worker, the cost of health insurance paid by the employer as a share of compensation for the low-paid worker has increased from 7.5% to 11.6%. So that's a 3 percentage point increase, 3.1 percentage point
4.1, 4.1. 4.1. It's over 50%.
4.1, yeah.
It's over 50%.
That's right, 4.1. Thank you for that correction. So 4.1 percentage point increase in the share of compensation that is required to pay for the employer to pay for health insurance for the low-paid worker. For the very highest paid worker, the 99th percentile, that share of compensation that goes to pay for health insurance did increase, but it only increased to 5.7%. So that was an increase from 4.5 to 5.7. I think I'll do the math right now, 1.2 percentage points. So the percentage point increase as a share of compensation was almost 4 times as increase for low-paid workers as for high-paid workers. And so for low-paid workers, it was 4.1%. For high-paid workers, it was 1.2%. And those are the facts. I don't think people can argue either with the logic or with the data in terms of that the consequences of rapid increases in health insurance are felt more by the low-paid workers than by the high-paid workers.
Well, they could argue they could say it's not a good study. They could argue it wasn't representative. They could argue it left out this or that. But what I find important about what you've done is that at least you have some measurement of this, which, let people argue with it if they want. Here's a paragraph from the paper I'm going to read that I found just so striking. A much shorter time period, but it really makes clear how these effects are important. And I'm going to read it selectively so that, again, we're bombarding listeners with a lot of numbers, and I hope you guys out there are doing okay. But it's so important. We're talking about 1999 to 2006. This is a 7-year period, and you're quoting again data from the Bureau of Labor Statistics. So the employer cost of healthcare for a low-wage worker went from 6.2 to 12.2% of compensation over that time period. That's just a huge increase. While total compensation for the group rose by 41% over that 7-year period. This is not corrected for inflation because it's not the point. 41%. Wages grew by only 28%. So if you looked at wages, say, well, over 7 years, they're up 28%. It's pretty good. It's not great, but it's okay. And you'd have to correct for inflation to see how much better off they actually were. But their compensation went up 41. That's a huge difference, 41 versus 28, trying to assess their well-being over that period. To go up to the high end, for a high-end worker, the top 1% over this period, smaller window than we just talked about, healthcare costs grew from 4 to 4.3, tiny increase in percentage terms. The more important point is earnings grew 35% compensation grew 36% for high-end workers because it's such a small portion. It's not that big a difference between compensation and earnings. However, if you just looked at earnings, the low-wage workers, their earnings only went up 28% compared to 35% for the high-end workers. So you'd say, well, inequality is growing. But if you looked at compensation went up 41% for low-wage workers and only 36% for high-end. So actually, the true inequality is getting smaller. And that's really the point of your paper. A lot of numbers there. But again, the basic intuition is pretty clear that if we looked at compensation rather than earnings, we'd see a different picture. We'd actually seeing the lowest wage workers in the data, the 30 percentile full-time workers, actually doing better. Their standard of living is growing faster than the people at the high end. But if you only look at earnings, you're misled. What about over the longer time period that you look at, 1992 to 2010?
Well, when you look over a longer period of time, of course, there are many other factors that are coming into play, although the advantage of looking at 92 to 2010 is they are similar points in the business cycle. So they're both at just immediately following the low point in the economic cycle. But still, there's a lot, over a longer period of time, the results aren't quite as striking. They're still there, so that about half the increase in inequality is explained by the increase in the healthcare costs, but it's not a one-for-one. So to be more specific, looking at this 92 to 2010 period, in the 30th percentile, earnings growth was 60%, but if you look at compensation, which includes the growth of healthcare costs, the very rapid growth of healthcare costs, the growth is 70%. Whereas if you look at the 99th percentile, earnings growth was 78%, and compensation growth for the 99th percentile was 82%. So you do have both earnings growth and compensation growth higher for the upper earners than for the lower workers. But, and this is the point of the analysis and the main finding here is that compensation growth grows more for the lower paid workers when you than looking at earnings growth alone. And it's relatively more for the lower paid workers than for the higher paid workers. So we still have the result that a big part of the increase, not all, but a big part of the increase in earnings inequality is explained for by the increase in the rapid increase in the growth of healthcare. And I want to sort of even move a little bit further in terms of thinking about it in terms of what role the government or government policy would have, and that is, if you just think that there's something nefarious going on in terms of, power relationships or just plain unfairness in the labor market between high-paid and low-paid workers, well, that, obviously indicates one set of policy prescriptions, increasing taxes on the high-paid and so on. But if a large part of the explanation is the increase in the cost of health care, well, that, and that's the cause, well, then you presumably should address the cause, and not the symptoms. And that clearly leads to an entirely different set of policy prescriptions and thoughts in terms of how to deal with this issue.
And you're suggesting that, in fact, compensation inequality may be falling while earnings inequality is rising. Is that a fair summary?
Yeah, either it's falling or it has not increased, or it has not increased certainly as much as what just the earnings and income data show. It depends on the data source and the time periods, but the broader point, which is consistent across different time periods and different ways of looking at the data, is that the increase in inequality is highly exaggerated when we look at just at earnings or income as opposed to total compensation.
So I want to raise one more issue related to this issue of who's going to pay for this and how it gets paid for. Going back to the example used at the very beginning of the conversation, if I'm making $40,000 in salary and $4,000 is in healthcare insurance that my employer is paying for me, and it doubles, or let's make it really dramatic, it quadruples or quintuples, and it's now $20,000 instead of $4,000, so it goes up to $60,000 is my compensation if I just got a free ride in healthcare, and my employer's not going to be able to afford that. So my employer is going to be tempted to take that whole $20,000 out of my income. And so I've got $44,000 in compensation, and they say to me, my employer says, well, I'm sorry, my healthcare costs are really expensive. You're no more productive. I'm going to give you a salary of now 24 instead of 40. I am going to respond by saying, I quit. I need to find a job that doesn't cover healthcare insurance. I'm going to go work for a firm that is homogeneous, only has low-wage workers, so it isn't a discriminatory problem, and none of us are going to get health care. Or if my employer already has low-wage workers mostly, they might just decide, folks, you're not going to get health care anymore. It's just too expensive. I can't afford it. And they might even conceivably have to give me a raise in my income. So react to that and how that might contaminate some of your results, because it's kind of amazing that workers in the 30th percentile are still 11% of their compensation is health care. You'd think a lot of them would want to work somewhere else maybe and have more income.
Yeah, it is an interesting and almost surprising result, but it is in the data. It's actually almost 12% of compensation is for the lower paid workers is the cost of healthcare. I would say there are a few things going on here. Number one is, healthcare is this, because it's so expensive, it is a risk to workers, and they do want insurance. They may not want to spend as much as it costs, but it's still nonetheless something that is of value to them, even if only as a covering a risk, like they have car insurance or homeowners insurance. So that's number one. Number two is it is still likely to be cheaper to be covered by an employer than it is to go out in the marketplace and buy insurance on your own, health insurance on your own, which is can be expensive, or you have to pass underwriting. EPS, and talking about the ACA, which is a whole other subject, but here we're talking about historical data through 2014. So the ACA was not a factor. So it still may be that it's better to be insured by your employer than to try to insure on your own. And it is also the case that you probably don't have an alternative in terms of Medicaid, or you might try to fund your health care costs on your own, but and maybe even try to get charity care from the hospital, but that's not. All these are sort of second best, and not the most desirable outcomes. And so, even though it's really a lot of money, it didn't happen overnight. Also, we have to remember this is a phenomenon that is long-standing, and precisely because it didn't happen one day, it was 4,000, and the next day it was 20,000. Where I think you would get your very strong reaction, but this has happened over time, so therefore it's more muted. The other consideration is it is a tax advantage to get it through your employer as opposed to paying it for it on your own, and that is a big advantage. And finally, I would say that it has happened somewhat, around the edges, and as you sort of note, if it's particularly in low wage firms, some employers have indeed dropped healthcare coverage. It hasn't been dramatic, but there has been some of that as well. So all of that taken, in total, I think explains the data. I mean, the bottom line is we still see it in the data that a very rapid increase in focus in percentage terms on the lower paid for the cost of healthcare.
Now, one of the problems with the paper or the claim, I don't know how to say it, is that most of the people who've tried, maybe all the people who've tried, except for you, who've tried to measure these kind of effects, have to bend themselves into pretzels to impute some kind of guess about healthcare costs to the certain class of workers or some measure of compensation. This data set that we're talking about, that you've drawn these conclusions from, again, the conclusions, there's a theoretical set of claims here that I think is almost impossible to argue with. Then there's an empirical question. How important is it? Your measure of the importance comes from a data set that is that only you have, it appears. So talk about where those data come from and why do you have access to it and other folks don't. It is the Bureau of Labor Statistics. That's good. It's not your uncle. But why aren't other people using these data to answer these questions?
Well, as you've indicated, the logic is so obvious that, obviously I'm not the only one to have sort of thought of this. So, for example, the Congressional Budget Office has looked at this question. Some scholars at the Brookings Institution have looked at this question, and they come up with a similar conclusion, but not as empirically as strong as what I have. And the reason why I believe that they don't come up with as strong empirical result is that they're using data sources which are sort of, I guess you could characterize them as indirect. They have to do some imputations, they have to do some smoothing, they have to get data from different data sources which are not always consistently measured. Sometimes they're measured with error because they rely on the recall of workers or households. So those data sources are inferior to what I have, which is the same data source that the Bureau of Labor Statistics uses to report on very widely quoted statistics on what's going on with wages and what's going on with the cost of hiring workers. These are very widely used and very widely respected statistics. I did have to ask for this data in terms of to get the detailed data on the numbers by compensation level. That is not something that the Bureau of Labor heretofore has reported, and I can't honestly say that I understand why others have been asked for it. It wasn't a slam dunk in terms of me getting it. It required a little bit of effort and a little bit of persistence on my part to convince them that this is a worthy study. But ultimately, they did provide me with these statistics, and I have to be very grateful to them for doing so. But I can't fully explain why others haven't tried to get these statistics, which I think are, as I indicated, are very high quality, and the same statistics are used for widely recognized and widely cited. The unique thing here was to get some of the detail on these earnings and compensation by earnings level. That's what's unique here and what has not been heretofore published.
And can other scholars get access to those data now?
I assume so if they ask.
Can you make those public?
It wasn't sort of mine to give, so I'm a little reluctant to offer on the behalf of the Bureau of Labor Statistics, statistics that they required a negotiation to get. So, but I think the question could be posed to the Bureau of Labor Statistics as to sharing it with others.
But the point is that the BLS puts out a ton of data, as do a lot of government agencies, and they put that out in various ways. So just to take an example, when Piketty and Say's look at inequality over time using IRS data, where they've done a similar kind of negotiation, I think. They get access to data from the IRS. They make public their data that they've created from the IRS. They don't make public the IRS data. They, in the course of, they very generously post all kinds of spreadsheets that an economist or interested person can play with themselves and check, and many people have, and that's great. But of course, there's a lot of stuff going on under the surface. There's a lot of imputed and implicit assumptions that are made to get to certain numbers in those spreadsheets, and that part's much more opaque. What I'm wondering is that when you present the numbers in your paper, in what sense are those just a straightforward arithmetic, ratios of things that the BLS provided versus crunching and assumptions behind them that you had to do to get to the conclusions you drew?
There's very little crunching and no imputations and no smoothing and no inferences. It is the spreadsheets were provided to me entirely based on the raw data. So there's very little of that. I think the issue, certainly with IRS statistics and I think also with the Bureau of Labor Statistics as well, is, these are surveys or actual data that come from, actual companies and actual individuals, and we do have to be mindful of their confidentiality. So, that's why there needs to be this negotiation, and when you get to more refined levels of this data to do this analysis, you do have to be a little more concerned about the ability to identify, IBM, has these data. That's a commercial secret to IBM, and they share this information with the BLS on the promise that their data will not be shared, their specific data. And similarly, with tax data, obviously, we have to be concerned about confidentiality. So it's a balance in terms of sharing all the data as opposed to being concerned about confidentiality. I think in my regard, the data there was very little crunching, almost no crunching. It's basically the raw data.
It's unfortunate, though, that we have to take your word for it for now. I mean, I know you're a nice guy. You could have made a mistake, though, right? Even the nicest person makes spreadsheet errors. It would be useful if the BLS would make this more widely available so people could confirm your numbers and their reliability.
I think that's a balance which is a broader issue, and an argument certainly could be made for the BLS to do so. I think also there's also a practical issue in terms of BLS provides a lot of data. They have limited staff, and so I think there's that element as well. But I think mainly it's a question of when you cut the data more finely, as you need to in this exercise, to look at levels of compensation, you have a little bit more risk of revealing confidential information. But that's a judgment and a balance.
And having said that, I want to conclude, and then I'll give you the last word. It's always going to be a question of magnitudes. There's always a question of how important things are that one notices or observes. And inevitably, there's imperfection in trying to measure those magnitudes. I spent a lot of time in this program talking about complex, sophisticated econometric analysis. That's not what this is. These are just some facts. Even facts can be tricky. You chose the 30th percentile on the grounds that was basically the full-time worker cutoff. As we said before, it could be the survey is not that representative. It's for reasons that we don't understand. It could be it leaves out certain categories of workers that are important. It's always issues that are even interpreting just basic, quote, facts. But I think the fundamental thing that I learned from your paper, and I think I'd like listeners to consider, is this idea that compensation and earnings are not the same, that our inevitable focus on earnings doesn't tell the whole story when we look at inequality.
Well, I appreciate the opportunity to talk about this, and let me just conclude with a little bit, moving a little bit into the policy realm. As we talk about inequality, and also as we talk about the repeal and replacement of the Affordable Care Act. I think the contribution that I'm making is the two are tied. That particularly as healthcare has grown as a share of income and just as a share of our economy. Now it's almost $1 out of every $5 in our economy. When we talk about inequality, when we talk about the role of health insurance and the cost of health insurance and who should pay for it, and how those programs should be set up, the two are so intertwined and so importantly connected to one another that we really have to think about them in the same breath almost. We should talk about them in the same breath. And as we go forward and design a replacement for the Affordable Care Act, I think we really need to really address the root cause of the problem of income inequality, which is the rising cost of healthcare costs. And I think we need to deal with that more directly. And we have been, and we've been very indirect and very tentative about it. I think we need to be more aggressive and more direct in addressing that problem.
My guest today has been Mark Warshawsky. Mark, thanks for being part of EconTalk.
Thank you.
This is EconTalk, part of the Library of Economics and Liberty. For more EconTalk, go to econtalk.org, where you can also comment on today's podcast and find links and readings related to today's conversation. The sound engineer for EconTalk is Rich Goyette. I'm your host, Russ Roberts. Thanks for listening. Talk to you on Monday.